Welcome to the NCD Alliance webinar. I will now turn it over to Dain, Executive Director of NCD Alliance.
Hi there, good morning, afternoon and evening everybody. Welcome to this NCD Alliance webinar on the 21st of October. We've got a very packed agenda for you with many different speakers, so let me just quickly go through the agenda before passing it over to the first speaker. Next slide please. So we have today speaking Priya Kanayson from the NCD Alliance team as well as Alena Matzke from the NCD Alliance team. We're very pleased that today we've got two guest speakers joining us. We have Nick Watts, who's the Director of Global Climate and Health Alliance, who will be speaking about the Climate Our Health campaign and the Conference of the Parties 21 Climate Change Conference coming up at the end of this year. And we also have Dr. Corinna, who is the co-chair of the Global Nutrition Report independent expert group, who will be joining us to talk about the Global Nutrition Report that was launched in September during the UN General Assembly. Next slide, please. So in terms of the agenda of what we're going to be covering, firstly, we'll be talking about the Global Development Campaign. So Priya will be updating on what happened during the UN General Assembly and particularly the UN Sustainable Development Summit, as well as giving an update on the post-2015 indicator development process, which is ongoing until March next year. Then we'll hand over to Nick to give an overview of our Climate, Our Health, a new campaign, and COP21, as I mentioned. Alena will be talking about the Global NCD Alliance Forum, as well as an update on the recent regional civil society preparatory meetings we've been holding in Africa. And then a WHO update, particularly on the regional committee meetings and the global coordination mechanism. And then finally, it will be Dr. Corinna to talk about the Global Nutrition Report 2015 and what this really means from an NCD and obesity perspective. So with no further ado, let me pass over to Priya to walk us through the Global Development Campaign. Over to you, Priya.
Thanks very much, Katie. So as Katie said, there's just a few things to go over from the global development side. I will be going over the recently concluded UN Sustainable Development Summit and the 70th General Assembly, and give a brief update on the post-2015 Global Indicator Framework development process. Next slide, please. So although it seems like this occurred months ago, the UN Sustainable Development Summit was less than a month ago. It was from September 25th to 27th, followed by the general debate of the UN General Assembly. The summit consisted of 6 interactive dialogues and concurrent plenary sessions during which heads of state and government delivered speeches on the occasion of the adoption of the 2030 Agenda for Sustainable Development, and a link to that adopted agenda is on the slide there, as well as an overview of the 6 themes. Health was covered under Dialogue 2, which was tackling inequalities, empowering women and girls, and leaving no one behind. The high-level week continued on Monday, September 28th, with the General Assembly, as I said, and that continued through the Saturday, October 3rd, and side events were held throughout the week, many of which focused on health. Next slide, please. So throughout the week, several key themes emerged during the head of state and government statements. Some of these themes included the overarching goal of the 2030 Agenda, which is eradicating extreme poverty, as well as reducing inequalities within and among countries. Achieving gender equality, eliminating violence against women and girls, and ensuring all children receive an education were often cited as key drivers of sustainable development. And given the current state of migration, the international refugee crisis is also a common topic throughout many of the statements. Several delegates spoke about the need to address terrorism and ensure peace, security, good governance, and the rule of law to promote development. The 3rd International Conference on Financing for Sustainable Development was also cited, and many heads of state and government called on each other to uphold and deliver on the commitments set forth in the Addis Ababa Action Agenda, which you can read using the link there, and highlighting the need for a revitalized global partnership in order to do so. And finally, many delegates spoke about the urgent need to address climate change and stressed the importance of the upcoming climate conference in Paris in December. Next slide, please. So in addition to some of the general themes, there was also a focus on health. Several heads of state and government actually referenced NCDs in their statements, urging concerted international action to address a growing public health burden. Among those who spoke on NCDs were Uruguay, the president of Uruguay, Switzerland, and Tonga. A full list of heads of state and governments who spoke on NCDs and their relevant statements, and also health more broadly, will be available on our website shortly, and we will provide you all with that soon. So in terms of what's next, the high-level political forum will be the main review body for goals and targets set forth in the agenda, and the first meeting of this will occur next year. And so a lot of the review work on accountability and monitoring will take place during this HLPF. The relevant UN committees whose work plans can be found using the link on the slide there will take up many of the issues in the agenda as well, specifically the second and third committees which deal with economic and social affairs. And of course, the global indicator framework will be an essential component of implementation, and I'll give a brief update on that in a few slides. Next slide, please. So some of the advocacy messages going forth when we were going into the General Assembly, we did go over this in our previous webinar, but as a reminder, the General Assembly is an annual opportunity for the NCD community to interact with other sectors and government officials and really promote NCDs in global development agendas. And this year was particularly important owing to the adoption of the 2030 Agenda for Sustainable Development, which provides not only a new global development agenda, but a new global health agenda as well. So Goal 3 on health goes far beyond the SDGs and the other goals contained in the SDGs aim to address the underlying factors of ill health. And so the General Assembly and Sustainable Development Summit was really an opportunity for us to celebrate the successful inclusion of NCDs in the new global agenda. Some of our key priorities for the NCD Alliance going into the General Assembly were to celebrate the inclusion of NCDs in the SDGs, launch our advocacy 2-page on NCDs and the SDGs, which you can view using the link, and to promote integration across the health sector and multi-sectoral partnerships, and to really stress that all stakeholders must deliver on the commitments made in the financing for development agenda agreed in July. And we also announced a change in NCDA leadership, which I'll go into shortly. Next slide, please. So the inclusion of NCDs in the post-2015 agenda is the result of what's been a 6-year campaign that began in 2009 when we as an alliance first set out to secure NCDs on the global development agenda. So this here shows the process along the past 6 years. In 2011, we had the high-level summit at the UN on NCDs and the adoption of the UN's political declaration on NCDs, followed by, in 2012, a 25 by 25 NCD mortality target, which was adopted at the World Health Assembly. This was followed in 2013 by the WHO Global NCD Action Plan, which was adopted at WHA in 2013. And then in 2014, we had the UN Task Force on NCDs and the Global Coordinating Mechanism, as well as the UN High-Level Review on NCDs, which resulted in a new outcome document from that meeting, which led us all to here, 2015, adoption of the Global Sustainable Development Agenda, which includes a standalone target on NCDs, as well as many other targets that directly affect NCD, the movement. So, next slide, please. So this is from our Advocacy 2-pager, which is available on our website, as I mentioned before. And what it does is it gives a snapshot of how NCDs are integrated throughout the SDGs and feed into the 3 pillars of sustainable development. So as you can see, NCDs are related to beyond Goal 3 on health, Goal 1 on poverty, 8 on economic growth, the Goal 7 on sustainable energy, Goal 2 on nutrition, and several others. So we are in the process of developing a more in-depth advocacy tool that will further show the linkages between NCDs and the SDGs. But in the meantime, we hope that this will be a useful tool for you. Next slide, please. This graphic shows how NCDs and the SDGs more broadly can be financed with some of the commitments that were set forth in the Addis Ababa Action Agenda. These include tobacco taxation, adequate and sustained domestic resources, continued official development assistance, ODA, and private sector investment. And again, these commitments are contained in the Addis Action Agenda, which and the full listing of which is available online. Next slide, please. And finally, we must not forget the means of implementation, which are crucial elements of the SDGs and necessary to achieve all goals and targets. The MOI, means of implementation, that you see here are those directly related to the NCD response and contained in Goal 3, which are implementation of the WHO Framework Convention for Tobacco Control, support research and development of vaccines and medicines, a strong health workforce, and strengthening capacity to manage health risks. Next slide, please. So moving right on to side events, we hosted our main side event on Saturday, September 26th, titled Translating the Post-2015 Agenda, Action on NCDs for a Sustainable Future. The event focused on practical ways for stakeholders to implement the SDGs in order to deliver progress for NCDs. Some of the key highlights were that there is a strong need for money, capacity, and data in order to measure what is being done and what is not being accomplished. And also a really strong call that prevention of NCDs goes beyond the health sector to sectors such as trade and infrastructure, which really highlights the need for multi-sectoral collaboration as we move into the implementation phase. Also, civil society must push governments when needed, but also be support for them when they need support in terms of capacity building, knowledge, and expertise. And finally, the UN system must evolve to understand that the cost of NCDs affects the whole of society, which is a message that we are, as an NCD community, are trying to promote through our advocacy toolkits. A full summary of the event will be on our website shortly. Next slide, please. In addition to our main external event, we also hosted a leadership reception on Thursday, September 24th, to celebrate inclusion of NCDs in the agenda, mark the transition in leadership of the NCD Alliance, and announce our new strategic plan for 2016 to 2020. And after 3 years of leadership and commitment, Dr. Carrie Adams, CEO of the Union for International Cancer Control, stepped down as chair of the NCD Alliance, and he is succeeded by Mr. Jose Luis Castro, who is executive director of the International Union Against Tuberculosis and Lung Disease. Also joining our leadership as vice chair is Ms. Fiona Ralston, CEO of the World Heart Federation. You can read the full statement announcing this change on our website using the link you see there. Next slide, please. And finally, on Friday, September 25th, we co-hosted the Health and Post-2015 NGO Strategy Meeting, where approximately 50 health advocates came together to discuss opportunities for engaging with these processes over the next year, as well as common priorities and opportunities for collaboration. So many of our colleagues in the health sector are looking towards implementation and how we as a community are continued to be involved in these processes to ensure that all of our joint interests are reflected. So some of the key areas for engagement that were identified were the global strategy for women's, children's, and adolescents' health, and there is a PMNCH, so the Partnership for Maternal, Newborn, and Child Health Post-2015 Working Group that will pick up on engagement with this process. There's the Primary Healthcare Performance Initiative, which is focused on measuring health data at the primary care level, and also the measurement and accountability for health process. All of those are linked there. And again, the indicator development process, which I'll go into in just a few slides. Next slide. In addition to our side events, there were many other NCD and health-related events, and what you see here are just a few of the many, many events that occurred. The top half are NCD-related, as you can see, and then the bottom are other health events. Next slide. So one of the big events was the launch of the updated global strategy for women's, children's, and adolescents' health. The development of the new global strategy involved several rounds of consultation, and the NCD Alliance, as well as I know many of you, also fed into the process. So the strategy has 3 overarching objectives that align with the SDGs. These are survive, thrive, and transform. And under each of these objectives, there's at least one sub-objective directly related to addressing NCDs. For survive, they have the target of reduced by 1/3 premature mortality from NCDs and promote mental health and well-being, which, as you know, is directly in Goal 3 on health. Under thrive, which is ensure health and well-being, end all forms of malnutrition and achieve UHC, and then transform, expand enabling environments, which includes civil registration and vital statistics, as well as enabling environments in terms of physical activity and urban spaces. So in the spirit of multi-sectoral collaboration, a new partnership called the Alliance of Alliances has been formed. There are 12 members, including the NCD Alliance and organizations focused on TB, the Stop TB Alliance, also water and sanitation, gender and equality, and clean cook stoves. The aim of the Alliance is to work closely together at global and national levels over the next 5 years to produce measurable results in knowledge exchange, advocacy, accountability, and analysis as it relates to achieving the goals and targets set forth in the global strategy. And so we expect more information forthcoming as we move into implementation. Next slide. So we hope that this slide will be a very useful tool for everybody, and it's also on our website, but it is a snapshot of some key publications that were launched during the General Assembly, which we thought were very useful. So again, the top portion are NCD publications, including our 2-pager, the WHO NCDs Progress Monitor, civil society reports, NCD Child Advocacy Guide, etc., FCA's Tobacco Control and the SDGs Toolkit. And then also in the global strategy, again, and accountability reports for every woman, every child, a report on aging and health, and also another report on reaching the SDGs by 2030. So if you know of any other relevant publications that are not listed here that should be included, please do send them to us and we will update the list on our website. Next slide, please. So right into the indicator development process for the 2030 agenda. I'm going to give just a brief update as not much has happened since our last webinar. And a quick overview: in August, we conducted a consultation with our network to inform a collective submission to the interagency expert group. The expert group then released a compilation of all inputs received on their website, which is the latest output on their website. And the original timeline posted earlier this year in March allowed for a second round of consultations before the upcoming meeting in Bangkok, but this has not happened, and so we now anticipate an updated proposed indicator framework after the Bangkok meeting. And at the bottom of the page, there's some important documents and resources, so including the website of the expert group, proposed work stream, and the updated list of priority indicators, which came out August 11th and is also the version that we provided comments on. Next slide, please. So the second meeting of the interagency expert group will be in Bangkok from October 26th to 28th. And the objectives are to review the list of possible global indicators, taking into account the submissions from the consultation process that was conducted in August, to discuss the framework, including interlinkages across targets and issues such as data disaggregation, and also discuss the work plan and next steps, because as was listed on the previous slide, the initial timeline allowed for a finalized indicator proposal on the 30th of November. And we have not yet received any information as to the revised timeline, but expect to see something after this Bangkok meeting. At the bottom of the page there's the provisional agenda and backup documents to inform the meeting, and also the summary of results from the open consultation process. And it's important to know the meeting will be webcast, and so you can find the relevant links on using the link on the slide there in case you are interested. Next slide, please. This slide might look a little familiar to some of you as it summarizes some of the highlights of our collective submission to the indicator consultation. It's just a reminder of what the current proposed indicators for the NCD targets are. There are two, as you can see there, and then the bottom here was a summary of what we proposed. So in addition to proposing alignment with existing indicators contained in the Global Monitoring Framework, we submitted proposed indicators on target 2.2 on nutrition, 3.5 substance abuse, 3.6 road traffic injuries, 3.9 air pollution, 7.1 sustainable energy, and target 11.2 on safe transport and physical activity. And again, those were collected as a result of our consultation process with the network. Next slide, please. So as we engage in this process, this is just a snapshot of what we've been doing and how we've been engaging with the indicator process since January. So our next opportunity to engage will be, as I said, after the Bangkok meeting, when we will have more information on next steps and any proposed timelines. So we will respond to the outcomes of the meeting in Bangkok and, of course, notify our network of any consultation process. Next slide, please. So now that the agenda is adopted, we're moving into the implementation phase, a process that all local, regional, and national organizations can influence. A first step to becoming involved in the implementation process is finding out what your government said at the General Assembly and during the summit, and sending a letter to relevant government officials congratulating them on the inclusion of NCDs in the agenda and offering support in implementation. The NCD Alliance will be providing a template letter that you can use, and it will be on our website soon. Sitting down to converse with relevant officials in ministries of health, finance, and planning to discuss how, if at all, they plan to incorporate Target 3.4 on NCDs into national health and development plans and priorities is also an important step for ensuring NCDs are part of not only the global development agenda, but national agendas as well. So we encourage you to do that if you are able. And we will continue to update you on the indicator process, but I also encourage you to follow the process on the website. And as always, please let us know of any planned activities or events by email. Thank you.
Thank you very much, Priya, for that really comprehensive overview of the UN Sustainable Development Summit and the indicator process. We currently don't have any questions at the moment coming in, but just to let me kind of really underscore the importance of this achievement for the NCD community. Obviously, many people on the phone today have been really part of this 6-year effort to get NCDs included in the Sustainable Development Goals. So it really is a major achievement. But as Priya was alluding to in her presentation, it's really now up to all of us to make sure that when governments are translating the SDGs from that global level to the national level, that both health remains very much central to national health and development plans, but also NCDs are better reflected. Okay, let's move on to our next presentation, and if anyone has any questions around the Sustainable Development Summit or the indicator process, feel free to tap them into the chat facility on the left-hand corner of your screens, and we can always come back to some questions later on in the webinar. So our next presentation is Nick Watts, who's the Director of the Global Climate and Health Alliance. And for those of you sitting around the phone thinking, what on earth why are we talking about climate change on an NCD Alliance webinar? I'm hopeful that Nick will be able to provide you with, why we're talking about NCDs, health and climate change and this new campaign that they have got going, Our Climate, Our Health. Over to you, Nick.
Sure. So thank you very, very much to the NCD Alliance and everyone here for having me. Very excited to be here and excited for groups like the Global Climate and Health Alliance and other climate change and health bodies to start to begin to step into and better recognize the links between non-communicable diseases and climate change. If I sound like I am far away, or if I sound like I have a funny accent, that's because I'm Australian. I apologize for that. What I was hoping to be able to do today was just talk very briefly through perhaps some of the links between non-communicable diseases and climate change, and then move on to a new campaign that the Global Climate and Health Alliance has launched recently in partnership with a whole range of non-governmental and governmental organizations, including the NCD Alliance. And if there are any questions at the end, then I'm more than happy to answer them, but also more than happy to be contacted by email and answer them that way. Next slide, please. So what I thought I would do is use a publication that's familiar to me to talk through some of these links. You see a screenshot or a scan, I think, of a recent LANCET commission on health and climate change that was published on the 23rd of June this year. I'll talk through this commission not because it was the first body of research, obviously, to explore these links between NCDs and climate change, but perhaps because it's the most up-to-date summary of the relationship that exists there, and because it's the paper I know well, and the weather's particularly good down in Australia. What the commission tried to do, as is written there in their own words, is map out the impact of climate change on human well-being, and then importantly, the necessary policy responses in order to ensure the highest attainable standards of health for populations worldwide. And it's really the second part of that sentence there that is unique, different, and new and interesting about this piece of work. In that what it's really doing is saying, look, a lot has been said and a lot has been thought about how you would respond to climate change if you were an engineer or an energy expert or an economist. But the policy responses really haven't been evaluated for their health impact, whether they're positive or negative. And that's what the Commission was trying to do, was to look at these different policy responses and reevaluate them and then hopefully reprioritize them based on the impact that they had on health. It was a multidisciplinary team that came together. It included climate scientists, geographers, engineers, energy experts, economists, and importantly, at every step of the way, health professionals to provide that link to health, and brought together a number of different countries and academic institutions: University College London, where I spend part of my time, Tsinghua University in Beijing, UNGA University, the United Nations University, Cambridge University, etc. Next slide, please. So this is a diagram from the LANCET Commission, which I think is intended to help summarize or simplify some of the links between climate change and human health. I'm not quite sure it manages to achieve that, but it certainly is comprehensive. Often when people think about climate change and health, they immediately jump to infectious diseases, to malaria, dengue, and certainly there are impacts in that regard in terms of changing distributions and changing exposure rates for populations. But when you look a little closer, many of the effects that we're most concerned about are actually non-communicable diseases. And this diagram here should help sort of demonstrate that, with greenhouse gas emissions and climate change up the top, and slowly moving through the various physical effects that climate change leads to, whether it is raised, average, and extreme temperatures, leading the whole way down to altered precipitation, and then stress on fisheries and agricultural productivity, and the eventual undernutrition and health impacts that brings. Raised temperatures leading to heat stress, increased ground level ozone, and heat waves. Many of the heat waves that are being attributed to climate change over the last decade or so are actually some of the most deadly. The one that is referenced most frequently is the 2003 heat wave in France and all across Western Europe, which resulted in as many as 30,000 excess deaths over the course of around a week and a half to 2 weeks. Most of those deaths through cardiovascular disease. Certainly respiratory disease is listed there as sort of a fairly all-encompassing category. And here this refers to the interaction of changing local weather and aeroallergens that result from new winds, new temperatures, coming in, increasing ground level ozone, increasing pollen allergenicity, and the burden that brings. And then finally, the impact that climate change has in terms of extreme weather events, directly on health through injury, and through the mental health impact of these extreme weather events and of mass migration that results. Already we're seeing as many as 7 countries worldwide which are implementing or at least have planned in place strategies for to move the entire population. These are sort of countrywide migration strategies, and the health effects of them as it applies to mental health really haven't yet even begun to be considered. So the Commission looked through this and described all of these influences and relationships between non-communicable diseases and climate change, and came to the conclusion that I think whilst all of these different impacts concern them, what was most concerning was the idea of a multi-hit scenario, was the idea of a population that was already experiencing undernutrition as a result of decreased agricultural productivity, as well as the spread of a new infectious disease, and then on top of that had a deconditioned population that was having to manage either an extreme weather event or a heat wave. And what happens when you start to wear away at the resilience and adaptive capacity of populations and of communities, and that's really what the Commission gets to at the crux of it when it comes to its first set of key messages, which are on the next slide. And these are that climate change, in large part because of the influence and the links between climate change and non-communicable diseases, is potentially catastrophic for human survival and human health, has the potential to undermine the last half-century of gain in development and global health, not just in low and middle-income countries, but in high-income countries as well. And in its own subjective opinion, refers to climate change as a medical emergency. It has new data to back this up. It talks about an additional 3 billion exposure events for elderly people experiencing heat wave and the cardiovascular disease they suffer from as a result. It talks about the 1.4 billion additional person drought exposure events per year by the end of the century, and the influence that has on undernutrition in low and middle income countries. And really lays out quite a concerning potential path forward. Next slide, please. But most importantly, and what I perhaps should have said to start with, is that is only 1/5 of the Commission's work. The other 4/5 of the work focus on how we can respond to climate change, and comes to the conclusion at the end of these 4/5 that responding to climate change could indeed be the greatest global health opportunity of the 21st century. Effectively, what it did was ask its engineers, energy experts, economists to look at all of the different things they would like to do to respond to climate change, and then reevaluated them in terms of their health impact, often prioritizing what was then determined to be no-regret solutions. These are things that are good for public health and cost-effective for public health anyway, independent of what future scenario we end up with in climate change. Next slide, please. And that's really where we get to the crux of the relationship and the most important part of the relationship between climate change and NCDs. Yes, there are important links in terms of the impacts, but when it comes to the solutions, as it turns out, many of the drivers of poor health, whether this is overconsumption and poor diet, inadequate air quality, poorly designed cities and energy choices, communities designed for cars instead of walking, are also drivers of climate change. And by tackling these together, we realize a co-benefit, which oftentimes provides cost savings to the health system, which then go back and often exceed the cost of the initial climate change intervention. And this is another one of those diagrams that perhaps doesn't necessarily simplify the situation, but does certainly cover it comprehensively. On the left-hand side, we have a whole suite of policies that you would like to enact, or the Commission would like to enact, as it applies to climate change, simply from a climate change perspective. On the right-hand side, there are the health and social benefits lined up whether this is decreased rates of osteoporosis, lower birth rates, cardiovascular disease, heat-related illnesses, respiratory illnesses. And the Commission goes through and talks about these in great detail. The three that it brings up that I think are most relevant to this group are in terms of air pollution. And this is when we talk about air pollution outdoors, primarily talking about air pollution from transport and from energy decisions, primarily coal-fired power. Globally, outdoor air pollution, ambient air pollution, is responsible for some 3.7 million deaths every year, and the burden there is primarily due to stroke, acute coronary syndrome, and exacerbations of chronic lung disease. In fact, the unpaid bill from fossil fuel consumption, which is principally in terms of the air pollution that comes from that fossil fuel consumption, is around $2.7 trillion every year. And so what the Commission talks about is the fact that a transition away from coal-fired power to more sustainable, cleaner, healthier energy choices is good for the environment, yes, but that's almost a secondary point compared to the benefits that leads to non-communicable diseases in terms of reduced rates there, and the huge reduction in burden that this brings on the health system and the cost savings that are appropriate there. And a number of countries, but most notably Europe through the last decade or so of interventions, has demonstrated that much of this is very much cost effective and in fact extremely beneficial for public health in the long run. The Commission also talks about how this might apply not just in the case of air pollution from cars and energy, but also transport. Ensuring suitable spatial planning and transport infrastructure to encourage active transport, reducing the rates of NCDs from sedentary lifestyle and obesity, or agriculture. A 30%, from the Commission, a 30% reduction in animal fat consumption, primarily from ruminants, red meat, could reduce heart disease by 15 to 16% in high consumption populations, and cut greenhouse gas emissions by up to 11%, which are not insubstantial numbers. Next slide, please. So into the campaign. All of this is occurring on the background of, obviously, the UN General Assembly, which we just heard of, but also a series of negotiations in climate change under the UN Framework Convention on Climate Change. In December this year, the world will come together for the next round of climate negotiations. And it's been doing this since 1992, but this time it's slightly different. This time in Paris, they plan to agree on a global framework with concrete commitments that include high, middle, low-income countries, not just high-income countries. Bans across mitigation, reduction of greenhouse gas emissions, adaptation, ensuring that, from our perspective, that health is protected from climate change, capacity building, technology transfer and trade, financial transfer and mechanisms, reporting and monitoring systems. It's a very comprehensive set of negotiations that they're bringing together. However, the health impact and the health responses, those benefits that I just mentioned, are not currently considered in these negotiations. And as health professionals, not nearly enough of us, I don't think, certainly not nearly enough down in Australia, where I am at the moment, are aware of the links here. So our climate, our health, exists to bring together and to coordinate and support the hundreds of initiatives that are happening all around the world, because there is so much happening internationally, and to help bring the profession together so that in Paris we can well, the way it was put to me that I think makes most sense is that we can be greater than the sum of our parts. And that's really the purpose of the campaign. Next slide, please. It brings together, as you can see, a very diverse range of partners, mainstream professional organizations like the World Medical Association, the World Health Organization, the European Respiratory Society, health NGOs like C3, the NCD Alliance, and many other environmental health alliances that make up the membership of the Global Climate and Health Alliance. Whether this is Healthcare Without Harm in the United States, Oratayo in New Zealand, Canadian Association for Physicians of the Environment in Canada. Hopefully we're a fairly broad, open and inclusive tent. Next slide, please. one of the key things that the campaign is doing is gathering up the various declarations, because there are a number of declarations that exist at the moment, looking to mobilize the profession and bring them together for Paris. Here are three of them in particular: the World Health Organization's call to action targeted at the general public, the 2020 Healthcare Challenge targeted at healthcare facilities, and Doctors for Climate Action, hosted by a number of the Royal Medical Colleges in Australia and the United Kingdom, targeted at, doctors. These declarations and many more, around 17 more nationally focused declarations, will be coming together and building up towards Paris to announce their commitments from the profession, from healthcare systems, and from the public on the 5th of December at our summit, at the Our Climate, Our Health Summit in Paris, right in the middle of the negotiations. Next slide, please. I'm aware that I'm about a minute or two over, so I'll try and wrap up. But this is just sort of a final slide to talk about a little bit of what we're doing and how anyone that's interested as individuals or their organizations can get involved. I'm not the person to talk to about this, but I'm told we have a very good web presence and online social media presence. Certainly there are plenty of resources up there from Did You Know, documents and briefings designed for ministers of health, ministers of the environment, local health systems, local municipalities. Coming soon are a series of country profiles which talk through the health impacts and relationships between climate change and non-communicable and communicable diseases, and the responses that benefit either of these. The Our Climate, Our Health campaign is hosting a number of events. There are 3 or 4 of them happening just today around the world, and online we have a map that links up and shows you where these different events are. There's plenty of opportunities to engage in national alliances. There are national climate and health alliances in around 25 countries. But if there isn't one in your country, then get in contact with us. We work very closely with new partners to source funding, provide strategic connections and networks of net NGOs that have done this before and have looked at setting this up in their own countries before. Engaging internationally certainly is another sort of thing. Paris is only 2 months away, so there's still plenty more to do. If you're coming to Paris, we'd love to have you along to our coordination meetings every morning in Paris. Attend one of the 15 different health side events that fall under the Our Climate, Our Health campaign, and then finally sign in the call to action, depending on how that fits in, whether you're a member of the general public, a health professional, or someone responsible for the healthcare system. So that's everything I've got to say. I'm sorry for running a little bit over time, but thank you very much for having me.
Fantastic. Thank you, Nick, and particularly thank you for presenting at nearly 2 o'clock in the morning your time. We really appreciate it. And the NCD Alliance is really excited to be part of this new campaign. I have a couple of questions for you, Nick, if that's all right. Firstly, just because we're obviously only 2 months before COP21, what kind of expectations can we have in terms of influencing the final agreement? Because it seems almost like it's fairly final already.
Yeah, sure. I think that's a good point. This has been building since 1992. Has been building for a long time, and a lot of the connections and establishments have been made. From our perspective, Paris is much more about a launch pad, really for mobilization and engaging with the health profession more broadly. Paris is not a moment where we will come to the end on the 12th of December and be able to conclude that we either have or have not solved climate change. It's really the beginning of that process. And Paris looks to set out a framework for up to from now to 2020 and then from 2020 and beyond. And I suppose from the perspective of the campaign, this is about bringing in health professionals and using this as a reason to engage with a much, much broader audience than we normally would, so that we can start to mainstream climate change, sustainable development into sort of the public health and medical discourse and lexicon.
Yeah, absolutely. And in terms of, because I imagine that for many of the people on the phone, attending a conference of the parties is fairly, new to them, and it is to us as well. I mean, what can NGOs expect in terms of actually, going to Paris and being involved in COP21? What opportunities are there for NGOs to be involved?
Yeah, sure. So in order to attend COP21, and indeed any of the COPs, there's a pre-registration period that's over now. But that doesn't mean, and certainly is open to any organization that applies for the future. So the next COP in Morocco next year, next conference of the parties. But I think most importantly, the last time we saw a climate change negotiation this big was in Copenhagen in 2009. And then in Copenhagen, whilst there were about 7,000 people that were inside the negotiation process, there were about 180,000 that were outside of it. And around that came a huge groundswell of public demonstrations, of side events, of education courses. It was really sort of quite an impressive establishment or array of support that came, trying to sort of provide that broader mobilization and engagement for the people that couldn't come in. So if people are able to physically be in Paris, there's plenty on. There's over 15 side events, one day, full sort of duration side events specifically dedicated to health over the 2 weeks. And there will be meetings sort of every morning to help try and coordinate and agree strategy for the health profession, I suppose, outside of COP. And there's certainly plenty of opportunities to engage. And that's just if you're outside of the negotiations. Once you get inside, it gets far more chaotic.
Great, thanks. And just one final question. You mentioned that there are now 25 national climate and health alliances around the world, which is very interesting because in the NCD Alliance community, what we've now got is around 36 national or regional NCD alliances. And it strikes me that there could be a good opportunity for those national NCD alliances to be connecting into the national climate and health alliances. Are the details of those health alliances available on your website so people can find out more about them?
The details of most of them are available on our website, but certainly that's something that I'll have to look into updating properly, or asking one of our team to update properly in the next few days. But yes, many of them are, about 20 of them are there in terms of the national alliance.
Great. Okay, well thanks again, Nick, for joining us, especially so early in your morning. Thank you. And now let's move on to the third speaker, which is Alena Matzke, who will be talking about the Global Entity Alliance Forum preparatory meetings, as well as an update on WHO in Geneva. Alena.
Hi, everyone. So we've taken you from New York via Paris over to Paris, and I'm going to take you further east to Sharjah, where the NCD Alliance is going to host its first global forum, bringing together approximately 100 national and regional representatives from national and regional alliances, together with an additional 100 global stakeholders, including CFOs in the wider NCD community and UN agencies such as the WHO and UNDP. I'm not going to give an update so much on the global forum itself, which is less than a month away. It'll take place on the 13th to the 15th of November, and as I said earlier, it's going to be held in Sharjah in the UAE. I'm going to give a brief update, next slide please, on the regional preparatory meetings that we have held in the lead-up to the Global Forum. We've seen a total of 5 regional preparatory meetings taking place in the span of just a few months. The first 2 took place in June, and then the very last one that I'm going to talk about today took place just 2 weeks ago in Kenya, in Nairobi. The objectives for these regional meetings were to share experiences, challenges, lessons learned, and best practices, to stimulate a multi-sectoral approach to NCD prevention and control, to explore, nurture, and support budding our new national and regional alliances, and to identify the specific region's main capacity building needs and advocacy priorities. On the slide, you can see the 5 meetings that have been held pre-Global Forum, and there will be 2 more meetings held in the European region in February in Brussels, and then also in the Western Pacific region, which is still TBC, but most likely will also be held in the first quarter of 2016. Next slide, please. All right, so the last in the series of 5 regional meetings pre-Global Forum took place in Nairobi, Kenya on the 2nd to the 3rd of October. The way this meeting came together was through discussions with the East Africa NCD Alliance Initiative, which is a sub-regional or a regional alliance really bringing together 5 different East African, no, 6 really, I think 6 East African countries, and they were hosting, or they were planning a meeting in October, and so we decided that we would try and bring the other existing NCD alliances from across Africa to this meeting, which we succeeded in. So this meeting was attended by about 35 participants, bringing together the 10 existing African NCD alliances, which are Tanzania, Kenya, Zanzibar, Uganda, Burundi, Rwanda, South Africa, Malawi, Nigeria, and Ethiopia, as well as representatives from the Global NCD Alliances and the Danish NCD Alliance, who is supporting the East Africa NCD Alliance initiative through a twinning initiative. And then also regional representative from the Framework Convention Alliance, so the regional FCA coordinator who's based in Cameroon joined us via Skype, and then also the World Lung Foundation and UICC sent representatives to the meeting. The meeting, very much like the other regional preparatory meetings, aim to strengthen the alliances through sharing of experiencing, mapping their existing capacity and capacity building needs, and then also engaging or finding out more about common priorities for joint regional advocacy. Thematic sessions at the meeting included a session on accountability and independent civil society monitoring, and then also a session looking at the integration of NCDs into national development plans and UN development assistance frameworks in greater detail. An interesting point raised during the meeting was around the chronic care model and the integration of NCDs into infectious disease programs. A lot of the alliances attending the meeting pointed out that this approach, which is of course much needed, is not only an opportunity but also includes potential risks as integrating NCDs into infectious disease models could potentially mean integrating them into vertical programs, something that we should really try and avoid and aim at a broader health systems strengthening approach. One of the outcomes of the meeting was the establishment of an Africa NCDs network. There's a working group right now working on the terms of reference of this network, and soon, hopefully, this network will also be open to other alliances and other regional stakeholders to join. Next slide, please. As I just said, one of the big outcomes of the meeting was the establishment of the ANN, the African NCDs network, and the priorities identified for regional advocacy and action which was an exercise that was actually undertaken by all of the regional meetings. We engaged all of the participants at the regional meetings in group work around identifying priorities for regional advocacy and action. And the priorities identified at this meeting were around integration of NCDs into national development plans and UN development assistance framework, the establishment of national high-level multi-sectoral NCD commissions, improving access to early detection and management of NCDs, and also the strengthening of human resource and institutional capacity for surveillance, monitoring, and evaluation. So these are priorities that this Africa NCDs network is going to take forward in their advocacy towards WHO Afro, towards national government, towards the African Union, etc. The participants at the meeting also identified the need to grow networks in the different regional blocks of political and economic relevance. So there's the Southern African Development Community, the East African Community, and then also the Eastern, the Economic Community of Western African States, to just mention a few, and those were really emphasized to be of great importance. Another priority was to increase engagement with WHO and UNDP country and regional offices, and one of the meeting recommendations was for the NCD Alliance to support capacity building activities in the region. And a meeting report will be available in the coming weeks. Next slide, please. Right. So I wanted to end this section just with a bit of an overview of common themes that we have observed in all of the meetings. So the first one really is a great interest in the formation of new national and regional alliances. Each meeting was followed by emails to us informing us over new alliances establishing at the national level, such as in the Maldives after the Southeast Asia meeting, or Saudi Arabia immediately after the meeting in the Eastern Mediterranean region, and then also really the acknowledgement that improved coordination and collaboration at the regional level was urgently needed. So a reflection of that is the establishment of the Africa NCDs network, and also ongoing efforts to build a MENA regional alliance for the Middle East. Not surprisingly, all meetings reflected the great need around organizational and advocacy capacity building needs. We're talking about human and financial resources, but also good governance, communication, and then strategic advocacy planning, and request to the NCD Alliance to help the growing network of national and regional alliances on this. One of the points that was very clear was that much more active engagement of non-health sectors was needed. So this is really across government, across all of the different ministries that are relevant to NCDs, such as agriculture, education, trade, and commerce, but also civil society, so reaching out to the broader development community, to development NGOs, to women's groups, to human rights advocates and environmental groups, and then also the UN system. So working with the UNDP, working with UNICEF and World Bank at the national and regional levels. And obviously this is a bit of a challenge given the size or the capacity of the alliances at the national and regional level so far. An interesting point was also around accountability. So really the meetings showed that accountability is a relatively new area for the NCD community. Many alliances are not yet involved in independent monitoring, even though there are a few alliances who have produced civil society status reports, but the vast majority have not engaged in accountability initiatives. And it also became quite clear that this point is quite sensitive to the political and cultural realities of a specific national alliance. The regional priorities that were identified by each of the meetings are really widely spread. So there's much more of a focus on risk factors, for example, in the Latin Americas, and then a much greater focus on health system strengthening and access to essential medicines and technologies in Africa. Other priorities are around integration of NCDs into national development plans. This is really acknowledged by most of the regions. Then the need to integrate NCDs into infectious disease and reproductive, maternal, and child health programs, and really being careful around the risks and opportunities of this. And then also really differing relationships and attitudes towards the private sector, specifically the unhealthy commodity industries, with some of the regions feeling much more strongly or having much stronger position around addressing conflict of interest and industry interference than other regions. All right, next slide, please. Okay, just a very, very brief update on the regional committee meetings. Next slide, please. I'm really filling in here for my colleague, Matzke, who has been following the regional committee meetings and probably would have done a much better job at this than I will. First regional meeting that I'm going to cover is the PAHO regional meeting, which took place about 3 weeks ago. One of the big sort of wins for the NCD community was the adoption of a plan of action on dementia. This is really PAHO is the first region to adopt a regional plan of action on dementia, and will really guide action on dementia in other regions as well. A bit of background to the plan in the region is that dementia in the Americas is set to increase from 9.4 million to almost 30 million by 2050. So really an urgent cause for action. And the plan outlines 5 strategic recommendations to member states to strengthen the response capacity of the health system. And there at the bottom of the slide, you'll find the media release following the adoption of the plan by Alzheimer's Disease International, providing you with more detail and calls to action. There's also a progress report on the implementation of the WHO FCTC. Whether it's good or bad news, the number of state parties to the FCTC has increased to 30 in the region. So still, I think the number of countries in the region is 47. So still a bit of a gap. So whether this is good or bad news, I leave that up to you to decide. But certainly progress with the ratification by El Salvador in 2014. The report also outlines progress achieved over taxation and on areas such as taxation and packaging. And if you're interested in learning more about this, I'll direct you to the link at the bottom of this slide to read more on this progress report. Next slide, please. The regional committee meeting that followed the PAHO meeting took place in Kuwait for the Eastern Mediterranean region. It saw the passing of a resolution on the implementation of the UN Political Declaration on NCDs, congratulating the regional director on his efforts to raise global and regional awareness on the magnitude of the problem, and also urging member states to take the necessary actions and to reduce premature mortality from NCDs. Acting on the fact that the mental health treatment gap in some countries of the region is as high as 90%, member states adopted a framework agreeing to scale up mental health care and implementing 4 strategic interventions. again, more detail on this framework can be found among the RCM documents at the bottom of the slide, together with the NCD Alliance statement delivered at this particular regional meeting. I'm going to skip over the additional agenda points here. Again, feel free to read up on what happened at the regional meeting through the link at the bottom of the slide. Next slide, please. And the final meeting that I'm going to cover is the meeting held in the Western Pacific region from the 12th to the 16th of November in Guam. There was a report on NCD prevention and control, noting progress on NCD plans and tobacco control. The meeting also passed a resolution on universal health coverage, urban health, and noted a report on aging and health. I apologize for being really fast on these slides, but we still have a lot to cover in this webinar. And again, I'll point you to the documents at the bottom of this slide. Next slide, please. The last regional meeting, the outstanding regional committee meeting, will take place in Chad in the African region, covering agenda items such as the post-2015 post-2015 development agenda and so key determinants of health and the establishment of an African medicine agencies. And to be noted, and it was the same as last year, that there is no specific NCD agenda item really reflecting the work that still needs to be done from an advocacy perspective in the region. I'll leave you with that for the RCMs, and we'll conclude my presentation with a note on the GCM dialogue. Next slide, please. That will take place at the end of November. The Global Coordination Mechanism of the World Health Organization is hosting this second dialogue on the theme of mobilizing international cooperation on NCDs through north, south, and triangular cooperation. You can find the background documents and online registration through the link included on this slide. The dialogue is really directed at both the health and broader development community, government, civil society, including patients and health workers, young people, the aging community, academia, donors, and the private sector. And the format is slightly different this time around. There was a first dialogue that took place in April of this year. And for the second dialogue, the WHO has approached several stakeholder groups to convene pre-meeting so-called caucuses on the day before the dialogue on the 29th of November. And there's going to be 3 stakeholder caucuses, one for NGOs, one for the private sector and philanthropic foundations, and one for the UN system. And the UN system will actually hold its caucus already next week around the meeting of the UN Interagency Task Force, which will take place on Monday and Tuesday next week in Geneva. And the objectives for the caucus meetings are to identify areas and opportunities for international cooperation and NCDs, and then also for each stakeholder group to develop a common position and a set of 1 to 3 concrete recommendations as input into the dialogue. And there will be a session at the dialogue where all of the stakeholder groups present their recommendations and time and space for discussions. And just to note that confirmed speakers for the dialogue include representatives of UNITA, of the World Bank, of a variety of civil society organizations, health workers, patients, and also WHO collaborating centers. Next slide, please. So we are pleased to be a co-convener of the NGO caucus together with the Young Professionals Chronic Disease Network. As I said, this caucus will take place on the 29th of November. It will be a half-day meeting from 12 to 6 o'clock, and take place in Geneva, and we'll announce the venue for this shortly. It'll be the same outputs as from the other other caucuses, aiming to develop a joint advocacy roadmap towards increased international cooperation in cities, and then also the formulation of 1 to 3 recommendations for concrete actions as input into the dialogue. If you wish to attend the civil society caucus, there is a link on the slide that you can use to let us know whether you're attending this caucus. So this is all from me, and I'll hand back over to Katie. Thank you very much.
Thanks, Alena. Thank you for covering so much ground in a short space of time. And we've got one quick question before handing over to Corinna from Paul Holmes at ACS. So, Alena, when you were talking about the Africa regional meeting in Nairobi that we held, you mentioned that there was some caution around integration of NCDs into infectious diseases and RMNCH programs. Could you say a little bit more about that kind of the word of caution from the Africa NCD advocates?
Yeah, sure. I think it was actually an interesting point, and unfortunately we didn't have all that much time to discuss this at the meeting, but it was definitely a point that a lot of participants felt strongly about. So just to make sure that I'm not being misunderstood, of course, everybody agrees with the need to integrate NCDs into existing programs, and I think this point is really around the fact that even though the integration agenda makes sense intellectually or logically, there's a lot of things that we don't understand. Everybody right now talks about integrating NCDs into existing programs, but there's a lot of nuances that we may not necessarily understand yet. And again, if we think of the fact that the MDGs created a lot of vertical programs, what does it mean to integrate NCDs into these vertical programs? Is that going to help us achieve broader health system strengthening objectives, or are we kind of reaching another impasse there? I'm happy to continue this conversation offline as I'm conscious of time, as Corinna is still going to present on the Global Nutrition Report. I'm hoping that this clarified a little bit what I said on this point. So kind of really just not just noting the opportunity, but really noting the fact that we need a lot more research into what this actually means.
Yeah, and making it a bit more specific, because I think a lot of people are feeling like the word integration is almost like a buzzword at the moment. It's being said in a lot of different places, but what does it actually mean in practice for integrating NCDs into HIV/AIDS service delivery platforms or MNCH as well? I think, yeah, absolutely. And just one other final question before we move on. Who's representing the ageing communities at the NGO caucus? That's a question from Charlotte at HelpAge.
Charlotte, I'm not entirely sure. We haven't looked at the list of RSVPs, but I can do that and come back to you directly offline.
Excellent, and we would very much welcome HelpAge being at that meeting, absolutely. Okay, thank you, Alena. Let's move on now, because as you say, we've got our final guest speaker. We're very pleased to have Dr. Corinna Hawkes on the line. Many of you will know Corinna. Her most recent, or her current role, is as co-chair of the Global Nutrition Report Independent Expert Group. And as I mentioned earlier, the Global Nutrition Report was launched in September, and it has a very strong focus on NCDs and overweight and obesity. So we're very pleased to have Corinna on the line. I hope you are on the line, Corinna.
I am. Can you hear me okay?
Great. Yes, we can hear you perfectly. Over to you.
Okay. Excellent. Thanks. Well, you're probably looking at a slide now that says Global Nutrition Report 2016. That 2016 reflects that we've already started to work on the 2016 report, but in fact, I'm going to be reporting today on the 2015 report. So great to be here, Katie, and thanks very much for asking me to contribute today. So moving on to the next slide, there's a picture of a couple of global nutrition reports there. We have produced to date 2 global nutrition reports. I have been co-chair of the independent expert group for the 2015 report, but I wasn't involved directly as co-chair for the 2014 report. So there's been these 2 reports, and I wanted to start by giving a little bit of history of this new reporting mechanism. If you go to the next slide, which is headed Nutrition for Growth. Nutrition for Growth was an event, a very, very political event that took place in London in 2013, which was co-hosted by the governments of the UK and the government of Brazil. It was a political event, and the tagline to it reflects that. There was a strong focus on undernutrition. The picture there is the Prime Minister of the United Kingdom, David Cameron, and he was very keen on focusing on the business angle. And as you can see by the words there, very strong focus on undernutrition. If you move on to the next slide, that's a summary of the commitments that were made. So the idea of this summit was for political, diplomatic reasons, but also from the perspective of the undernutrition community around the world, to try and encourage countries to make clear commitments, financial commitments largely, but other commitments as well, to undernutrition. And a series of initiatives were developed as a result of this, one of which was this call for an annual global report on nutrition. So there was a decision made that if we were going to have commitments to nutrition, then we needed to hold not just business, but governments and so on accountable for actually meeting those commitments. So that were the origins of the Global Nutrition Report. Moving on to the next slide. The way that the Global Nutrition Report emerged was somewhat. It was founded in the NCDs. It's called the Nutrition for Growth process, but it really emerged as a sort of independent report that was focused on accountability, not just of the Nutrition for Growth process, but of nutrition action around the world. So its ambition expanded significantly, and it fundamentally is the only nutrition accountability, true a comprehensive nutrition accountability report. And for that reason, it has a stakeholder group, which are the kind of stakeholders, which include funders, so the people who have a stake in who are the ones who are really making a commitment. So that's government, it's industry, it's the international agencies. So they provide overall kind of guidance, if you like. But actually, what the report actually says and what it does is managed by a completely independent group. Some of that, so there are some members from the agencies, but they're acting in an independent capacity. The rest of us are independent and academics, and we act independently. And we can be guided by the stakeholder group, but we don't have to take on board what they are asking us to do. So it is very independent. Moving on to the next slide, headed Global Targets 2025 then. If the Global Nutrition Report was going to hold the world accountable, what was it going to hold the world accountable to? Remembering that it was established in the context of undernutrition, for that community, that meant the global targets that have been set by the Nutrition Department of the World Health Organization, or rather by the member states of the World Health Organization, through the Comprehensive Plan on Maternal and Young Child Nutrition in 2012. And you can see there are 6 targets, which include stunting, anemia, low birth weight, overweight, childhood overweight, under 5 childhood overweight, breastfeeding, and wasting. And so the report tracks progress, the data towards meeting those targets. And on the next slide, it shows the specific interventions which are tracked by the report, again on undernutrition. But in addition to these specific interventions, which were defined by LANCET series on undernutrition in 2008, followed by in 2013, it also tracks what's called nutrition-sensitive interventions, which are interventions made in other sectors and making them more sensitive to nutritional concerns. So that was what happened in the origins of the report in 2014. I was asked one of the mandates I was given, moving on to the next slide, was to broaden the report to make it much more comprehensive in terms of the types of malnutrition that it brought on board. So this slide shows that obesity is part of that picture. And another thing that I try to do is to bring in nutrition-related non-communicable diseases into that picture and to say, look, malnutrition means bad nutrition. And we know that bad nutrition leads to a certain proportion of NCDs. It's not shown on this infographic, but that was very much part of what we were trying to do. So on the next slide, you'll see something you'll probably be familiar with, which is the Global Monitoring Framework for NCD. So what we decided to do in the 2015 report was also to track progress towards the diabetes and obesity targets. So we use WHO data for that, but we use our own methodology, which was agreed on by the different UN agencies and us, into how we actually say, how can we judge whether a country is actually moving towards that target. And on to the next slide, which shows the cover of the Global Action Plan on NCDs. We also wanted to track progress in implementing the actions included in this action plan from the healthy diet. So often this isn't, we're not using our own data here, we're taking data from the WHO and putting it together with all the other data to really show the overall impression of all types of malnutrition. So on the next slide, you'll see the table of contents of the 2015 Global Nutrition Report, and you can see there that it's very much about assessing progress and accountability. So we assess progress against the nutrition status targets, including obesity and diabetes, against the commitments made in Nutrition for Growth, against the policy actions that are being taken, the financing for nutrition, and accountability for nutrition. But we also wanted to try and bring in more actors similar to the NCD community, bringing more actors from outside NCD to understand how important they are. We're trying to do the same with nutrition, and we focused on two other kind of big sectors, big areas, one of which was climate change and the other which was food systems. So how can we work with other communities to try and make climate change and food systems more accountable to improving nutrition? But what I want to do just very briefly next is just take you through the results that we came up with for the nutrition status indicators. So if you go into the next slide, you'll see it's headed Progress on Stunting Reduction. So for those of you not familiar with the undernutrition terminology, and many people are not, that means that when you don't grow properly, so you're too short for your age, and that often happens in the first 2 years of life. So what's happening is that countries around the world are putting an enormous amount of effort into trying to reduce stunting in their populations. So in just 1 year, we had quite a big jump of a number of countries who were on course to reduce this form of malnutrition. So that's really good news. But of course, you can see that 60 countries of those that we tracked are still off course to meet that WHO target. The next slide looks at wasting, which basically means being too thin. And again, you see that the increased commitment that we see around the world to undernutrition is leading to some gains. But again, still a large number of countries are not on course. Now, the next slide looks at under 5 overweight reduction. This was a result that was very surprising to us, that there was actually an increase in the number of countries who are on course to meet the overweight target. This is largely, we think, to do with the nature of the data, and it is only under 5 overweight data, which is quite limited. So one of the things we're going to be doing next is commissioning a piece of work to try and understand this, because as you'll see from the slide, in a couple of slides, that's not also the case for adult obesity. On the next slide is breastfeeding, much more mixed here. There's much less progress, particularly in East Asia. We're seeing countries with female participation in labour force shoot up, which unfortunately with poor maternity leave legislation is having a negative impact on breastfeeding rates. So not as much progress there as we'd like to see. Then the next slide is on adult obesity rates, again taking WHO data. And here we have a situation where from model data, the WHO is telling us that there's no, and using our own methodology for assessing whether they're on target or not, we have no countries on track at all to meet that zero increase target. And we have on diabetes, which is the other thing that we tracked, is that only 5 countries have halted the rise of the diabetes indicator, which we used, i.e. of raised blood glucose. So in other words, we were seeing modest progress, but still some decent progress in undernutrition, and no progress, at least for adults, on obesity and diabetes. So the next slide will show that websites, blogs, and the international media and national media who normally are interested in undernutrition began to report a lot more on our findings about obesity this year. So there was a lot more traction gained from that, and also on diabetes as well. And on the next slide, we're also very happy. You'll recognise these names. They're main part of the NCD community to receive endorsements from key figures in the non-communicable disease community as a way of trying to highlight that our report is really trying to reach out much more to the NCD community, and for us as a community to find it a useful report. And on the next slide, we have a series of recommendations that are around NCDs and obesity. I'm just going to highlight one, which is one for the research community. One of the findings from the tracking we did on the policy actions was that they were in silos. So there were policy actions and interventions to try and reduce undernutrition, and there were policy actions and interventions to try and reduce obesity by increasing, and NCDs by increasing healthy eating. And they were operated by different units of government in silos. So one of the calls that we make is that we need to say, look, that actually some things in common between these forms of malnutrition, that high diet quality can be good for addressing NCDs and good for addressing undernutrition. And we have a lot of money going into undernutrition, and that some of that money could be used effectively to make sure that the programs and policies being implemented are also sensitive to the concerns about rising obesity and NCDs. So we call particularly on researchers to come together to identify what we're calling double duty actions to address both. And Lawrence Haddad, the other co-chair, and I had a blog about this in the LANCET where you can read a bit more about it. And on the next slide, just to end with Global Nutrition Report 2016. So as you saw at the beginning, we are mandated to be an annual report. So we have already started to work on the next report. And as part of that, we want to do an even better job, or try and do better, on bringing obesity and NCDs into the picture. So the focus of the 2016 report, which will be released in advance of a big summit of the Nutrition for Growth process in Brazil in August, will be from commitment to action to impact. And I just picked out some of the things we want to include about healthy eating, obesity and NCDs. We want to know from you what the smart and ambitious targets and commitments are for obesity and NCDs. What do they look like? If we're going to go to a meeting full of people with undernutrition and say, you need to be making smart and ambitious commitments for obesity and NCDs, and they say, what does that look like? We want to be able to tell them. So we're going to be having a piece of work on that. We want to, again, look at how well countries are doing in implementing healthy diet policies. We want to look more closely at food environments and systems as underlying determinants of obesity and NCDs, in the context of the fact they're also underlying determinants of undernutrition. And we want to look much more at the financing piece. At the moment, we have a lot on financing of undernutrition, but we're going to be including some work on the financing of NCDs. And we want to include some really good case studies from obesity and NCDs. What are the countries that have made really strong commitments? What are the countries that have illustrated commitments to action? And what are some examples of some really good lessons learned from the policy processes leading up to successful implementation? So if you have any ideas of case studies we can include, or ideas for how we could help boost the content for the first 4 bullet points, please do email me. Finally, to follow on from that, what can the NCD community do? Well, this is just a statement that we make: read it, share it, shake it, talk about it, and act on it. Please do send examples I've just said, but also please send critique directly to me, because we are not doing a good enough job yet on the NCD side, and we want to do better. So please do send any comments that you have. Please feel free to talk about the Global Nutrition Report at events. And a plea from me personally, I think we need to have greater engagement between the NCD and undernutrition communities and the nutrition community more broadly. So a call from us for that also. So I'll end there with the URL where you can download the nutrition report. Thank you.
Excellent. Thanks, Corinna, for that really good presentation. I've got a couple of questions here for you. First and foremost, obviously the GNR as a whole, the report is a really, really important advocacy tool for the NCD community, because it obviously really shows that countries are so far off track, particularly on that obesity target that you mentioned. Does the report say anything about why no countries are on track for that obesity target?
That's a really good question. I had a reporter come to me and ask me about Nauru, because Nauru is the only Pacific country, Pacific island, in which female obesity has gone down by an insignificant amount. And that was the only thing we could find. And she asked me, well, tell us why. And actually there isn't a really good analysis out there of why that is. So we don't have enough good data and analysis and evidence to really say that, except that we know from our work tracking policies that when you look at the policies that have been put into place, they're still very patchy. So we have countries doing things here and there on nutrition-related NCDs and obesity, but not putting into place a really, really concerted effort. And we see countries doing hugely concerted efforts on something where they're saying, I will not be embarrassed by this anymore. I am doing everything I can to get stunting down. You don't see that on obesity. You don't see that kind of really rigorous, comprehensive strategy.
And do you think that's partly because within the undernutrition community, they've had that very clear kind of, set of cost-effective interventions for a while that that governments obviously know very well, and that we perhaps haven't got that really, the really kind of solid interventions for obesity, awareness of it anyway, out there yet?
Yeah, I think that's definitely part of it. I think that there needs to be awareness that it's not an intractable problem, and it can be addressed. I really do think that's part of it. But when you look at all the different success stories in undernutrition, what holds them together is it's not necessarily just about specific interventions. So some of it's poverty related. So when poverty goes down, undernutrition tends to go down broadly. But what pulls them all together is commitment. And that's the one factor that seems to emerge from every case. So commitment might mean that they're implementing those 12 specific interventions. It might mean they're doing something about water and sanitation, which is very important for undernutrition. So I think what really needs to happen is for more advocacy and mobilisation to get that commitment up. And then when the commitment is there, then you can open your door and give them the interventions that we know can be effective against obesity and NCDs.
Mm-hmm. And your final recommendations on the previous slide was that you want to really see a greater kind of engagement between the NCD community and the undernutrition community. Obviously next year in Rio is the follow-up meeting of the Nutrition for Growth Summit, follow-up from London. What kind of opportunities are there for the NCD community to get involved in that?
It's a really, really good question, and I was speaking with the government of Brazil who were hosting the event just the other day. And because of political events in Brazil at the moment, it's been very hard for them to really get the organisation of this event off the ground. But there are three strands that they're building up at the moment, one of which is a very high-level meeting, which is going to bring together religious leaders and sporting leaders with government leaders at a very high-level event. So I think this could be some real advocacy to the government to make sure that some very high-level people are there from the NCD community at that event to give them the opportunity to talk to the other high-level people there. The second aspect of it is going to be actually quite research-focused, bringing together a research network. And I think, again, there's opportunities that's only just being developed for the obesity and NCD research community to come in there. But I think the government of Brazil is overall very keen to see this move to a greater obesity focus. They do have an obesity focus. So I think just in general, making sure that representatives from the NCD and obesity community are present at events that deal with undernutrition, because what you'll find is a very receptive community. The undernutrition wants to deal with NCDs and obesity now in a way that 10 years just wasn't the case. So I think having a presence at these events is very important.
Mm-hmm. Great. And just one final question. I know that the Global Nutrition Report is having various different country launches, as well as obviously the more kind of globally focused events like the one in New York. Is there somewhere on your website that people can get an overview of the different country launches that are going to happen?
That is a really good question. I was actually looking for myself earlier because I was going to make a list and I couldn't exactly find one. So I'm not sure if we have actually a clear list on the website yet. I will contact the person who does our website to ask if there's any plans for that. Because like we're having one in Pakistan, Samia Nishtar will be speaking at that. That's in December. So there are some really exciting ones coming up, and we're trying to, at each of those events, making sure that obesity and NCDs is represented in some way. So if anybody wants to know that launch list, send me an email, and in the meantime, I'll see if we can get that on our website.
Okay, great. Thanks very much, Corinna, for joining us today and for your presentation.
Well, thank you. It's a pleasure.
And I think that takes us to the end of our webinar today. So apologies for going over slightly on the time, but let me thank both Nick and Corinna again for joining us as guest speakers, and obviously to Priya and Alena for all your presentations. And I should have said at the beginning that obviously all of the PowerPoint slides will be available on our website for people to download, as will a recording of the webinar in case you want to listen to any part of it again. Our next webinar will be in the next 6 weeks or 2 months. We'll get back to you with a specific date shortly. Thanks everyone for joining. Goodbye.
Ladies and gentlemen, that does conclude the webinar for today. We thank you for your participation and ask that you please disconnect your line.